Hi, I'm Vikram. I'm one of the second-year residents here at Wills Eye Hospital. This morning started, as many mornings during the academic year, with a lecture in the morning. We're adapting to COVID just like every other program. So we did a Zoom lecture which lasted about an hour. It was on corneal trauma. And this morning, after that lecture, I actually went to cornea clinic where I was with one of the first years and one of the third years. On average, we see between 20 and 30 patients as a group in these half-day clinics. Very smooth clinic. We ended up finishing a little bit early, had a chance to grab lunch, and in the afternoon I was in our cataract and primary eye care clinic. That's also a very busy clinic. We have 2 to 3 attendings staffing up to 5 residents at a time. We see everything from dry eye and viral pink eye to cataracts and other complex problems. Saw several patients there, and it ends up being close to 8 or 9 patients you'll see during a half day. And otherwise, we staff with the attendings. We get a lot of teaching and feedback about our experience, things that we saw or didn't see on our exams. Overall, a great learning experience. And then the day ends typically around 5 or 5:30. So I've had a really great experience here at Wills Eye since I've been here for the last year, almost a year and a half. I think everyone here is introduced to ophthalmology through a 3-week course where we learn the terminology, get acclimated with what we're going to be seeing on the physical exam, and then, like many others, we're thrown into the mix and allowed to see patients on our own. We have excellent supervision in the clinics and far more autonomy in the emergency room, particularly overnight. I think the greatest part of this experience has just been seeing the entire diversity of ophthalmology here. There's almost nothing that you'll go through training without seeing, and you have a chance to talk to some of the world's experts about how they manage these conditions. And I think one of the unique aspects of Wills Eye is not only the size and scope of it, but also the incredible diversity in opinions and thought processes of all the attendings who've all trained either here or in some of the top programs around the country. So I think even in a year and a half, I've been exposed to the diversity of clinical care and surgical care and how they manage these unique issues. And I think I've been presented with this broad viewpoint that I think I can apply well as I go forward in my career. There's one patient that I think I tend to remember, especially when I have some quiet weekends, that I can think about my experience so far at Wills. One that I think captures the fact that I've started my training through a pretty interesting period in our country's history as far as COVID and the recent pandemic. I remember seeing a patient in the Wills ER who came in with double vision, and we eventually got some imaging that demonstrated that she had thyroid eye disease. And what I remember most about that patient experience was the fact that she was Filipino, and I had to interact almost entirely through her husband, who was translating for us during the exam. I saw her for follow-up about 3 weeks later in our plastics clinic, and incredibly, during that short interval, her husband had caught COVID and passed away. And she still came to her appointment just 3 weeks later, and it really reinforced to me not only how lucky we are to have our health and be able to see these patients and help them with their problems, but how incredibly important patients' sight is to them. Because regardless of the fact that her husband had passed away just a week prior, she still felt like her vision was important enough to come back to see us for follow-up. So that patient really stands out to me. It helps reinforce why I went into ophthalmology, helps also put into perspective what else is going on in the world today. I think the main reason anyone chooses a program is based on how they make decisions. And for me, I made a decision based on my gut. I was lucky in that I had a chance to come through Wills Eye as a visiting medical student during my 4th year. And I had a chance to interact with some of the junior residents at that time. And I found that regardless of how busy the Wills ER was or the clinics were, they took particular attention to teach, to spend some time talking about my experience, why they talked about why they chose ophthalmology. And I think what was reflected best at that point was, regardless of how hard they worked, they had a very clear mission for why they were here, and they had a great deal of camaraderie with their fellow residents. And I think for me, when I was choosing a program, I felt that I needed to go to a place where I'd get excellent training for certain, but also where I'd come away feeling like I had joined something larger and was part of a family. And I think Wills really exemplifies that in all of its regards. And when I had the chance to come back and interview here, I felt that there was a warmth to this program that was lacking, at least to me, from some of the other top places. And it only reinforced the initial thoughts I'd had during my away rotation. And I ranked it at the top and have never looked back since. I absolutely love Philadelphia. So I have spent my whole life in the Midwest after I moved from India, and it's been smaller Midwest towns, Cincinnati and St. Louis. And while I have a special place in my heart for both of those places, neither have been as large or as lively or as diverse a city as Philadelphia. I think there's a number of factors that make this my favorite place to live so far. One is the family that I have here. My brother moved here recently, and it's been amazing to have a chance to grow with him now that we're in a different stage in our lives than high school and middle school. And the second is the community that I've developed here. I think Philadelphia is definitely the city of brotherly love, and I think the friendships I've made through residency and even outside of it have really made this place home.